From the 15th of February, UK residents and Irish nationals travelling into the UK from the 33 countries in the government's coronavirus red list, that covers much of South America, Southern Africa, United Arab Emirates, Portugal, will have to spend 10 nights in a government-approved facility in quarantine. We've been talking about this tonight. As yet, it is not clear where those facilities will be. The Department of Health and Social Care has said discussions with Australia and New Zealand have taken place to share expertise on quarantining. Both countries have been successfully using quarantine as part of an elimination approach to dealing with the virus. Let's speak to Professor Michael Baker. Michael is a public health physician and acting head of the Department of Public Health at the University of Otago in Wellington. He's a member of the Ministry of Health's COVID-19 Technical Advisory Group, and he's also taken a leading role in formulating New Zealand's elimination strategy against the pandemic. My goodness, Michael, you sound like a very busy man. Good evening, Professor.
Well, greetings from New Zealand. Yes, I think it's been a very intense year for many of us.
How tough do you have to be with quarantines, Michael, to make them work?
Well, in the case of countries eliminating the virus, you have to be very tough. This is the big question I've got for the UK is why are you doing this, putting this effort into your borders if you're not heading towards elimination? Because the whole basis for quarantine at borders and how vigorously you pursue that depends on what you're trying to achieve.
Is the virus not at such an endemic level in the UK that we couldn't eliminate it?
Well, I think we've had areas like obviously Wuhan in China, but more recently Victoria in Australia had a resurgence that was more intense than the UK at that time, and they then went and eliminated the virus, and they have no transmission there. So, yeah, the UK could certainly eliminate it if it chose to.
How? Sorry, before I ask for that, Michael, New Zealand, where you are, New Zealand has had 25 deaths from the virus. Now, if we had seen a similar level of mortality, taking into account our bigger population here in the UK, we'd have had around 340 deaths. So that shows how this New Zealand model, certainly it can be strongly argued, has worked. So how can we eliminate this virus?
Well, there's three things you have to do, and I think obviously managing your borders is key, but you also have to stamp out transmission or damp down transmission using masks, and you would need a period of lockdown, which I think you have anyway. And the third thing is testing and tracing. You also need a social safety net to support people, which I think you have anyway. So this is the thing that's astounded me, looking at many Western countries. It's not just the UK, it's Europe and North America, countries that have all the resources needed to eliminate the virus. Why you didn't take the elimination path was we just looked at what China had done and Taiwan and said, well, they've basically either excluded the virus or stamped it out, doing the things I was talking about. So that seems like the obvious model. So we just did that. We've just followed what works. And I must admit, I'm still surprised that much of the Western world didn't follow that same path.
But talk me through exactly what you've done. So a lockdown for how long?
Well, we had a very intense lockdown for 5 weeks and then 2 more weeks at a lesser lockdown. And then we basically emerged into a virus-free country. And we used that time, obviously we'd introduced border quarantine, which is what you're talking about in the UK. Because if you stamp out the virus, you obviously can't allow it to come back in. And then we set up a high-volume testing and contact tracing. So that if we did get occasional cases, which we have had, you do get failures at the quarantine facilities occasionally, and you have to have that ability to basically test for cases and then do the contact tracing. But there's nothing in this that the UK can't do.
How intense was the lockdown? Like, what would happen if people broke it?
I think it was very similar to many countries. So, I mean, essentially it's a stay-at-home order. And in total, people were required to stay at home for 7 weeks. But obviously, you could go out for essentials and healthcare and exercise, the usual sort of things. But that was enough to basically eliminate the virus. Because remember, the virus only survives if it can transmit between people. And if you put the whole country into home quarantine, basically that extinguishes it.
But, and when people went out to get food and exercise in your country, Michael, what type of tolerance was there for people who didn't respect the rules, didn't wear a face mask, didn't keep the social distancing? What type of tolerance was there for people who would have house parties in the middle of your lockdown?
Look, there was very low tolerance for that behaviour. I think because people could see that the reason for doing this was there was an end in sight. So it wasn't going to be forever. You weren't going to go in and out of lockdowns for a year. It was to get rid of the virus so you could resume normal activities. And basically that's what we did. So it meant there was very few cases in New Zealand and obviously very few deaths. And now the economy's bounced back extremely well. And we actually just published after a year, or best part of a year of data in the British Medical Journal just before Christmas, an analysis looking across the globe. And what it showed was that protecting public health was very good for the economy, so it also protected the economy. The two go together. It's a false dichotomy to say if you save the people, you wreck your economy. It's quite the opposite.
So we're in lockdown in this country. What are we doing wrong?
Well, I think the thing is the critical element is you have to have a very clear shared goal, and that is zero COVID in the community. That is the key thing. We had that goal early on in New Zealand, and it works. If all of your focus is towards having no cases, you organise your systems accordingly, and people can get behind a shared goal, and that's what happened in New Zealand.
But again, what are we doing wrong here? We have that goal here in the UK. We have a goal of reducing transmission as much as possible, and there is a government policy that we must stay at home unless it is absolutely necessary to leave. So what are we doing wrong, Michael?
Well, all of the elements have got to be coordinated. So if you add in the border controls, you've got the lockdown and mask use to suppress transmission. Then you need the high volume testing, contact tracing to mop up any remaining cases. And you've got everything you need. It's just coordinating them and having that shared commitment to doing that. And also now you've got another fantastic new tool, of course, vaccines, which, as well as protecting vulnerable people, almost certainly do stop transmission or greatly reduce it. So elimination should not be far off for you if you're committed to it.
You know, when I think of how long our government has left the borders open, obviously they're hammering down now, but they didn't at the beginning. Do you think that was a fundamental mistake?
Yes, I mean, of course, you have to have a plan, and then you have to follow it through. And in Australia, they had some states were committed to elimination right at the beginning and succeeded extremely well. Others were less certain and said, "Oh, we'll just try and suppress it." It turned out that was a very bad idea. And I think that's what the UK has, a suppression model. If you tolerate cases in the community, they just start up the outbreak again as soon as you take your foot off the brake. You must have no tolerance for the virus. That's the absolute critical requirement.
Share with me some experiences of other countries who have experienced, in your view, success around this.
Well, the list at the moment we're starting with mainland China, which is protecting about 1.4 billion people. They get the occasional resurgence, but they stamp on it very vigorously.
Do you believe their figures?
I do, because I've got colleagues in China and journalists who are reporting. I think they have largely extinguished the virus. But then you look at adjoining countries like Vietnam. They're protecting 100 million people. They've gone for long periods with no transmission. Then you've got Cambodia, Laos, Thailand, Singapore that are largely succeeding. Hong Kong for most of the time. So there's quite a long list, and they're very different countries that have succeeded, and they've got long, complex borders. And if they can do it, of course the UK can do it.
So, given the thousands of infections we currently have, Michael, are you saying that we could turn this round if we are serious about quarantine, if we're serious about lockdown? We're in the middle of a lockdown now. Are you saying we could turn this round in 5 weeks?
It would take a bit longer because it's a very entrenched epidemic. But the experience in Victoria suggests yes, you can. The combination of using all these methods effectively would succeed because the virus is nothing magical about it. It only exists if it can transmit between people, and if it can't do that anymore, it basically is extinguished.
Michael, thank you very much indeed. Mohammed, I just found